I'm happy to introduce you, if you haven't already heard, of Envita's genetically targeted fractionated chemotherapy. Now, we started this many years ago with the advent of using bioinformatics and testing, very sophisticated data we capture for our patients to know exactly which chemotherapy they need. Let me tell you how important this is. The majority of our patients that come to Envita find that they were given the wrong chemotherapy, the responses had become resistant, and we knew that ahead of time by doing the right testing. Our testing helps us to identify the right chemotherapy. All chemotherapy isn't bad. And then once you have the right chemotherapy, we find people can use metronomic dosing. They don't need mega doses. Why? When you give maximum therapeutic dose, oftentimes you're going to get resistance with the chemo if it's not working. You're going to get weakening of the immune system. The disease mutates and the percentage of mutation goes up and it spreads. How do you avoid that? With targeting. So when you know what agents are going to be best to treat with, you can give them at lower doses and the patient has less side effects. Our patients at Envita, I'm proud to announce, report 95% less side effects than previous radiation, chemo, or surgery that they got elsewhere. Why? Because of precision. Precision integrative oncology makes all the difference. From the chemotherapy on to everything else that we do, it's all about targeting. This is the future of chemotherapy. And the reason you don't see this everywhere else is because usually it's not billed by standard insurance companies. They don't work in this regimen. They work in standard NCCN guidelines, which have a place in maybe early stage disease. But as that disease progresses, you need precision to be built on you. Not something that was done in a clinical trial way back when on a number of patients with a same name cancer, but the actual genetic mutations that are linked to your cancer, the markers that work for your cancer. And that is what we have found has given our patients a great advantage clinically. So I want to welcome you to Envita's GTFC, genetically targeted fractionated chemotherapy. We have a team standing by to help answer your questions that only work with late stage and complex cancers, and they're here to help you. May God help you and bless you on your journey to healing, and don't hesitate to reach out. We're here to help you.